Hi, and welcome to Cablevision's Neighborhood Journal, a show about places to go and people to see, right here on Long Island. Cardiology, neurology, and physical therapy. When you hear these words, I bet you're not thinking of a vet. The Center for Specialized Veterinary Care is a hospital unlike any that you and your pet have experienced. It's a place where the emotional needs of the pet's entire family are as important as the superior veterinary care they provide.
Thor had some bladder stones. He was having a problem urinating.
Pongo had cancer of the spleen, and his spleen was removed, and the prognosis wasn't good, so my vet sent us here.
He seems to be a little uncomfortable here. See him start to shake.
Bampi has 2 mast cell tumors under both armpits.
Good boy.
He's got skin cancer on his face.
Everybody else said he wasn't going to make it. They had it so far, 7 months on now.
I started the Center for Specialized Veterinary Care because I really believed that there was a void that needed to be filled, not just on Long Island, but in veterinary medicine in general.
Here we come, Lori.
Oh, it's dramatically small. Dramatically.
On Long Island, we do have several specialty referral centers. This center is different because it incorporates every single kind of specialty possible. And they're all under one roof. And every doctor works together. And every doctor is motivated to work together. And we're all here because we're all passionate about the same thing.
A big part of this practice is that we all work as a team, because whether it's a medicine case that needs surgery or an oncology cancer case that needs surgery, it's important that the specialists that are best at each area work together to make sure the patient receives the best total care.
The specialties that exist today, most people are surprised to hear that we have veterinary cardiologists, neurologists, dermatologists, ophthalmologists, oncologists, cancer specialists. We have physical rehabilitation, orthopedic surgery, brain surgery. We have everything that you could possibly offer in human medicine we have today in veterinary medicine. As sophisticated as nuclear imaging, MRIs, CAT scans. We're the only place in New York now that's doing continuous hemodialysis for acute renal failure or sudden kidney failure, and we're really, really proud of that.
These are 2 sisters. They were adopted from North Shore Animal League together, and Allie has been limping for about 3 weeks, and it turns out she tore what would be an ACLU in a human being, or a cruciate ligament, they tell me, in a dog, so she has to have surgery.
Actually, Allie is a pretty typical patient. She is a young black lab who has sustained an orthopedic injury. So she's torn her ligament, she has some pain in her knee is unstable, and we know that for her to return to a normal active life with minimal arthritis in her knee, surgery is the best way to go for her. Part of orthopedic surgery is not the surgery itself, but also what we do in the recovery period. So we had a long talk with the owner about how much she needs to address the post-operative care, mostly restricted activity, and then we also have a physical therapy center, which I think really improves the recovery of our patients.
A lot of people are shocked, but the truth of the matter is, when you look at people and you see how well they do with the physical therapy, it makes logical sense that animals who are so much more athletic than most of us would really benefit from the physical therapy, because it helps them tremendously get back on their feet and running and moving around.
The little doggy treadmill is great. You know, she's looking at me like, "Can you make me exercise? Yeah. Forget it."
Well, I've been a veterinarian now for 15 years, and there was always somebody every single day who said, "Can I stay with my pet? Can I please stay with my pet? I'll climb in the cage. I'll sleep on the floor. I won't bother anybody. I'll sleep in the lobby." And there have been so many times where the veterinarians, they want people to be able to be with them, but it just wasn't practical. And as I built this center, I decided, why don't we build rooms where people can stay with their pets? It's not fancy, but it's practical. And so we've been able to now incorporate that into the care of pets. And luckily, it's something that's been very well received, not just on Long Island, but around the world.
That's the main reason we came here, because with these 2, they've never been separated, even by a room. So when it comes to her recovery, she's going to be a lot less stressed if we're there for her.
I spent the afternoon with him yesterday after surgery. This was just a wonderful place, just wonderful. It's just the best. It does help because they said he was crying and moaning this morning, and now he's calm and peaceful because Mommy's here.
We know that our patients are part of families, and so our goal is to make sure that our owners understand what we're doing, what we need to do, and our patients are treated just like they were our own family members.
The treatment's been really good. I'm really not nervous at all about that. I'm just nervous because, you know, it's like my four-legged daughter.
The people here are very kind. All the nurses, all the ladies behind the counter, everybody's been really good. They're taking good care of us.
You have to like people. You really do. You have to love animals, but you have to care about people. And that's one of the criteria to work here. It's not just the toys and the tools and the CAT scans and the ultrasounds. It's the people that make this a special place.
That is really something. It's good to hear a place like this exists on Long Island. For more information on the center, you can contact them at 516-420-0000 or visit their comprehensive website at vetspecialist.com. And be sure to come right back here on Journal, where we will be going more in-depth on the center and meet some of their specialists and some of their patients.